All right, welcome everybody. My name is Brooke. I'm a program coordinator here at Alzheimer's Services, and I wanted to welcome y'all to our final presentation as a part of our Making Sense of Sense series for the beginning of the year. We've had a really good turnout for this series. So if you have attended all three presentations, then you are able to receive a free consultation with an elder law attorney. I will reach out to you with all of that contact information within the coming days, but I so appreciate everybody who has joined us for this series. I also wanted to extend an invitation to all of our upcoming events that we have. You can find a lot of those on our website. We have a TLC coming up, Arts and Alzheimer's, always have our Care Partners support groups, always lots of good stuff. So if you're interested in receiving even more support and programs from us, it is available, and we look forward to seeing you there. Just some housekeeping. This call will be recorded and we'll put it on our YouTube channel following. And that also is where you can find a lot of our previous recorded presentations. And then we will remain muted throughout the call today. But if you have any questions or any tech problems, go ahead and put them in the chat and I will help you out. And then I also finally am going to go ahead and introduce our presenter, Miss Barbara Gooden. So I'm going to read to y'all a little bit of her bio. Miss Barbara came to SHIP, which is a part of the Louisiana Department of Insurance, in January of 2007. And she has been working as a Medicare counselor. She has a background in home health and worked in medical record supervision for 8 years. She currently works within Medicare beneficiaries for well over 19 years. And she's one of the senior counselors that works with Medicare beneficiaries in the state of Louisiana. SHIP provides objective counseling, outreach, and materials in all areas of senior insurance markets at no cost to consumers. And this includes information on Medicare, Medicaid programs, Medicare supplement insurance like Medigap, Medicare Advantage plans, and Part D plans. So I'm so glad that we have someone who is well qualified to talk to us about this subject. I know a lot of times whenever I hear about Medicare and supplement plans, Advantage plans, Part D, A, B, XYZ, it all kind of sounds like mumbo jumbo in my brain. And so I'm so glad that we have someone like Miss Barbara here to really lay out things and give us a good overview of Medicare, what it covers, what it doesn't cover, and how we can best make decisions for ourselves regarding our health insurance. So, Miss Barbara, thank you for being here with us today. I'm going to go ahead and pass things over to you.
Thank you. Good morning, everybody. Well, good afternoon, I'm sorry. My name is Barbara, and I'm going to be going over this Medicare information with you guys today. First of all, what is Medicare? Medicare is health insurance. It's federal health insurance for three groups of people. Those 65 and older, under 65 with certain disabilities, like they may be blind or be amputees. They may have ALS, Lou Gehrig's disease, or end-stage renal disease. End-stage renal disease, that means they are taking dialysis. ALS, if they have Lou Gehrig's disease, they get Medicare right away. They give it to them really quick. End-stage renal disease, they have to wait 24 months before they get Medicare. They're going to be on Social Security disability for 24 months. Month number 25, they automatically give them the Medicare. Of course, most people don't learn about Medicare till it's time to leave an employer coverage or leave Medicaid when they're no longer qualified for Medicaid and cross over. And once you cross over to Medicare, it's a whole new world. Medicare is health insurance, but it's not full coverage. Medicare is cost sharing. That means they pay 80% and you are responsible for the other 20%. So you have to share in the cost. Unlike Medicaid, Medicaid paid 100% of everything, but Medicare, you have to share in the cost. There are four parts of Medicare. Part A, that's hospital. Part B is your medical. C is the Medicare Advantage plans like the HMOs, the PPOs, and of course, Part D is drugs. And Medicare Advantage plans do vary by parish. All Medicare Advantage plans are not offered in all zip code areas. All depends on the area of the state you live in. The hospital coverage, that is for inpatient hospital stay. That means have been formally admitted into the hospital with a written doctor's order. And that's what Medicare Part A pays for. B is the medical, that's your doctor visits, your lab work, your DME supplies, outpatient services, your preventive services. And the Medicare Advantage plans, like I said, like the HMOs, PPOs, the People's Health, WellCare. We have Blue Advantage, Humanas, several plans here in the state of Louisiana. And of course, you must have drug coverage, whether it be a standalone drug plan or it can be included in the Medicare Advantage plan or it could be from an employer plan. As long as you have drug coverage, you'll be okay. Now, this is what Medicare covered. They cover hospital stays. Like I said last time, it's inpatient hospital stays. Sometimes you may go to the emergency room and they say, oh, we're going to hold you for observation. That is not the same as being an inpatient in the hospital. When they hold you for observation, it looks like you're in a hospital. You may even put you in a room, but that does not mean that you've been formally admitted into the hospital. So you have to be in the hospital with a written doctor's order. If you are not inpatient, a written doctor's order in the hospital, they may hold you up for observation for several days. Now, with an inpatient hospital stay, if you're in a hospital for 3 days, then you get to go to a skilled nursing facility. But if you're in for observation, you can't go to the skilled nursing facility. You must have an inpatient hospital stay. So it's good to make sure that you ask, when you're at the emergency room, am I inpatient or outpatient? If you have a Medicare Advantage plan, it does just like Medicare. If you have a Medicare Advantage plan, if you have a certain amount copay that you pay when you go into the hospital. But if they do not formally admit you into that hospital, those co-pays are going to change. Instead of paying $50 for outpatient, you might be paying $275 a day. They're going to charge you 20% for everything they do for you in that emergency room if you are not formally admitted into that hospital. Preventive care, of course, that's your mammograms, colonoscopies, your flu shots, pneumonia shots, all your vaccines, DME supplies, outpatient services. That's your little clinics on the outside. If you don't want to go to the emergency room, sometime you might go to lake after hours or something like that. Medical equipment, that's your DME supplies, your wheelchairs, your walkers, the bedside commodes, things of that nature. What Medicare does not cover? Medicare does not cover dental. The only way Medicare would cover dental is if you were to have head or neck cancer and you had to get your teeth pulled out before radiation or chemo treatment, or if you were in a bad car accident and you have to have some kind of reconstructive jaw surgery, things of that nature. That's the only way original Medicare will pay for dental. Vision. Medicare doesn't pay for vision unless you have diabetes and they would screen you for diabetic retinopathy, but you have to be a diabetic and they only do that once a year. Now, what Medicare will also do is when it comes to vision is pay for your first pair of eyeglasses after cataract surgery. Hearing aids, Medicare does not pay for hearing aids. Now, the Part B of Medicare will pay for like a diagnostic hearing imbalance test to make sure to prevent falls. It's like a fall prevention exam. But that has to be with a written doctor's order. You can't just go and say, okay, I want this done. Medicare pays for it. That's not how it works. You have to have a doctor's order, written doctor's order for that. Long-term care, Medicare does not pay for long-term care. They don't pay for any custodial care. They don't pay for room and board. If you go to assisted living facility, they don't pay for people to come and sit with you. No live-in aides, no non-medical services. They don't pay for anything like that. Now, you can, if you had a long-term care insurance, what most people purchase when they're younger. So when they get older, they may need that help is already in place. Or your income may be low enough to qualify for Medicaid. If that's the case, then you'll get the long-term care that way, or you can go to the VA. The VA does provide some long-term care. Prescription drug plans, you cannot get prescription without the Part D. Part D was mandated in 2006 after Hurricane Katrina in 2005. A lot of people were displaced and they could not get their medicines, didn't have any information on their drug plans and things like that. So it became mandatory January 2006 that everybody had to have drug coverage, whether it be with an employer plan, a standalone drug plan, or part of a Medicare Advantage plan. Everybody has to have it. So if you don't pick up the Part D, as in drug, you would have a penalty of 1% for every month you don't pick that Part D up. Two ways to get Medicare. So the original Medicare, that's your red, white, and blue card. Original Medicare is only Part A and Part B. That's all original Medicare is. The Part D, you must pick it up from a private company. But all of these private companies are approved by Medicare. The Medicare Advantage plan, however, covers doctors, hospital, and medication. So you already have medication built, the drugs are built into that particular program. So remember, Part A and B, that's all original Medicare is. Now, Medicare has a contract with the Medicare Advantage plans, and that contract says that they have to oversee your Part A and B of Medicare because that's all original Medicare is. But because they want you to do business with them, they give you some added benefits like dental, vision, and hearing. They may give you a gym membership. All depends on your level of Medicaid. There are some special needs plans. They may give you a food card. They may give you transportation. So they have a lot of added benefits. But remember, Medicare don't regulate those added benefits. That's just a perk from the plan. That's strictly up to the plan, the benefits, those extra benefits that they give you. And if you need assistance with it, you can always call SHIP. We'd be happy to provide you help with finding a plan. Generally, when you call us, we'll ask you for your list of medications, the name of your pharmacy, and we'll put that information in the system to make sure that all of your medications are covered on the plan number one. And when you're looking at a Medicare Advantage plan, you got to make sure that your doctor takes that particular plan. So what I would advise is before you start looking for a plan, call your doctors, find out what Medicare health plans they work with, because all doctors do not work with all Medicare Advantage plans. So if you're a person and you're receiving home health, and you change plans. Okay, well, decide I'm gonna change plans from Humana, and now I'm going to People's Health. And they call me and say, well, I can't see you anymore. Why? Because you changed plans and we don't work with that particular plan. So you got to be careful with the home health as well. With original Medicare, you can go to any doctor that accepts Medicare. Original Medicare is accepted all over the country, anywhere in the continental United States. They don't have any networks, and you don't have to have a referral to use your red, white, and blue card. But it doesn't cover drugs, so you have to pick up a standalone drug plan to go along with it. And they have no out-of-pocket limit. That means you can pay quite a bit over a year's time. I mean, it don't have a bottom like the Medicare Advantage plan. They have set amounts. Once you reach, okay, certain plan might say after $6,900, you've met your out-of-pocket limit, and the company will pick up the rest. That's how the Medicare Advantage plans are set up. But original Medicare, there's no limit. It could be in depth. It's a lot. It can go up to quite a bit of money out of pocket. Now, the Medicare Advantage, of course, like I said, is all in one coverage. It covers doctors, hospital, and medications. They often include dental, vision, hearing. They give you X amount of dollars for each every year. And they do have out-of-pocket limits. All depend on which plan you choose. The out-of-pocket limit may be different. One plan might be $4,900 for the year. Another plan might be $10,000 for the year. But it all depends on which plan you choose, what the out-of-pocket limit is. Of course, you got to go to, if you have an HMO, you have to go to the doctors and hospitals in the network. If you go to a doctor outside of the network, you may have to pay that out of pocket. So as long as you stay within the network, you should be fine. But sometimes they allow you to go out of network if you have a I think it's like for the dental part of it though. If like the HMO with the point of service option, that's for dental, then they still have a network. When you're in the network, you pay one price. If you go out of the network, you pay a higher price. Original Medicare versus the Medicare Advantage. So with the original Medicare, the red, white, and blue card, you can go any doctor you want to, anywhere in the country, as long as they take Medicare. If they do not take Medicare, if you decide to still go to that doctor, you're going to have to pay out of pocket, and they can charge you at least 15% more than what original Medicare would pay. Then you'll have to pay that out of pocket. They don't have no kind of network, so you don't have to worry about where you go. But like I said, the Part D is separate. You have to pick up a standalone drug plan, and there is no limit. Medicare Advantage plan, doctors, hospital, and drugs. The majority of them, you have maybe two or three that don't cover drugs. And in that instance, like a person is on VA to get their medicine from the VA, then they don't have to have a drug plan because the VA is credible coverage. So all they need is a Medicare Advantage plan that just covers doctors and hospitals. So we have a couple of those. So the network of providers with the HMOs, the PPOs, with the PPOs, you can go anywhere you like. You can go to any doctor you want to. But the thing is, if you have an in-network price and you have an out-of-network price. If you go in the network, it's one price. It might cost you $30 for a doctor visit in the network. You go out for a specialist. If you go outside the network, that same visit might cost you $50. So it would be to your advantage to stay in the network. But if you go outside the network, it is allowed. Now with the HMOs, they you have to get a referral to go and see your specialist with the HMOs. So you got to go to your primary doctor to get a referral to go to a specialist. With the PPO, you don't need a referral to go to the specialist with the PPOs. And of course, it does include extra benefits, like I said, dental, vision, hearing, the gym benefit. They have a gym membership. They have transportation for some, and an over-counter benefit as well. And like I said, they do have out-of-pocket limits. All the plans have different limits. They set their own out-of-pocket limits. So if you have a complaint about a Medicare Advantage plan, you want to go to that plan, you call the plan and make a complaint with them. We don't oversee them, the Medicare Advantage plan, but if you can't get anywhere with the plan itself, then you call 1-800-Medicare. Medicare regulates the Medicare Advantage plans. Original Medicare, again, like I said, it covers A and B, and you have to pick up a drug plan. But with the 20% that Medicare doesn't pay, you have to pick up a supplement of what they call a Medigap plan, and you can use that anywhere in the United States, but it only works with original Medicare. With Medicare Advantage, you pay that 20% you eat up the 20% by paying set copays, zero copay for primary doctor with Medicare Advantage. And the other copay could be anywhere from $20 to $50 for the specialist. And that's how you eat up that 20% that Medicare doesn't pay. But you are responsible for paying the 20% that Medicare doesn't pay because it is cost sharing. So these are some frequently asked questions. Medicare is not free. Well, some people think it's free because they've been on Medicaid so long and everything was free. But Medicare is not free. It's cost sharing. You have to share in the cost. It's an 80-20 split. And like I said, you have the choice on how you pick up the plan, the original Medicare or Medicare Advantage. The drug plan, you must have a Part D plan. Sometimes people say, well, I'm not going to pick up the Part D because I'm not taking any medicines. And then 10 years down the road, then you might be on 10 or 12 meds, and now you want to pick it up. When you do pick it up, there will be a penalty attached to it for every month that you didn't have it. 10 years down the road, that's a 120% penalty that you're going to have, and it's going to follow you. Those are lifetime penalties unless you have low income and qualify for some of those special needs plan or Medicaid or low income subsidy with Social Security. And we'll talk about that later. And doctor access depends on the plan, yes. Certain plans allow you to access certain doctors or what have you, but all depends on the plan and their list of providers. All providers are not on all the doctors' lists. It all depends on where you live. You may not have as many hospitals and doctors to access, so all the plans are different. And you must review your plans annually. Every open enrollment period from October 15th to December 7th, please review your plans. You should get letters from if you have a Medicare Advantage plan, you're going to get letters from your plans and letting you know if there are any changes to your plan for the next year. And they'll have it noted, like if you have medicine that's dropping from the formulary, if your doctor is no longer with that plan, or that plan is just leaving the network, period, you'll be notified. If you have get help with the state, they'll let you know. If they send you a letter, it might tell you, okay, you no longer qualify for extra help. You have to reapply. We're not going to automatically roll you over. So if you get anything from Social Security or your plan, please, you can call us. We'd be glad to help you with it. Common misconceptions. Medicare covers everything. No, Medicare doesn't cover everything. Again, they don't cover dental, vision, or hearing except for special circumstances. The dental, if you're getting some kind of reconstructive surgery, or if you're getting ready for chemo or radiation, and sometimes they may have to pull your teeth before you get those chemo and radiation treatments. Medicare isn't free. No, Medicare, it costs $202.90. That's the Part B. Part A is generally premium free if you work the 40 quarters, but the Part B costs $202.90. And it also has a $283 deductible. You pay that deductible once a year, but that premium is every month. All plans are not the same. All plans are not the same. You have all kinds of plans. You have the special needs plans. That's for people on Medicare and Medicaid. Then you have the regular Medicare Advantage plan, like the HMOs. You got the HMOs. You can go. You got to go to the doctors in the network. PPOs, you can go in and out the network as you choose. But if you go outside the network, it's going to be a higher cost to you. Now, this slide is talking about the help with the medication costs and the Medicaid. On the left side, you'll see low income subsidy program that is administered through the Social Security office. We normally call that the extra help program. That program helps with medication costs. It is income driven, but they do take into consideration whether or not you have other people that live in the house with you that depends on you for financial support, whether they be marriage or adoption. You could be a grandparent raising grandchildren. So they take that into consideration. So on the top, it might say the monthly income for the individual is 13. The most you can make is 1330. And for a couple, it's 1804. So that's how they look at it. They look at it as individual and couple. So if you are married and living together, you are a couple. And that's how they see it. So you can't say, okay, we're separated. So if you're separated, you cannot be living in the same household using the same address. So they're going to look at you as a married couple. And then you'll get the lower copays for your medicine. That helps you with your medication costs. Just if without having the low income subsidy or the extra help, you may pay maybe say $500 for Eliquis. If you qualify for the low income subsidy or the extra help program, you won't only pay $12.95 for that Eliquis. So it's a good benefit. If you've never been screened for it, please, you can call us. We'd be glad to do an application on you. Now, the middle section, the Medicare Savings Program, that is Medicaid for people that's on Medicare. And this program is strictly income driven. They don't care how many people live in your home. They don't take none of that into consideration. They only take into consideration how much is the total household income, whether you are married and single. That's what they look at. There's no wiggle room with their prices. If you're $1 over, you do not qualify. So the first level at the QMB program, if you qualify for the QMB program, that particular program is going to pay all your copays and deductibles for you. They're also going to pay the Part B premium for you, and you'll still get the extra help for your medications. Anything in that middle section, whether it be QI, the QMB program, the SLMB program, or the QI program, they all will pay your Part B premium. You will get the low copays no matter what level of Medicaid you have under that program. You'll all get that. The only one that's going to pay your copays and deductibles is the QMB program. QMB will not only pay for your Part B premium, but it will also pay your Part A premium if you don't have enough quarters. So if you would like information on that, I'd be glad to help you with that program as well. And here are the key takeaways. Medicare has coverage gaps. Those gaps are the Part B premium, the Part B deductible. Original Medicare also has a hospital deductible. That hospital deductible is $1,736. Part B premium, $202.90. Part B deductible, $283. Those are your gaps. And when you choose those health plans, whether you choose a Medicare Advantage plan or a Medigap policy, the Medigap policy take care of all of those deductibles for you except the Part B deductible. Because Medicare is cost sharing, you have to pay your own Part B deductible on the Medigap plans. And of course, again, we do offer free, confidential, unbiased help with anything, any Medicare needs you may have. And these are our little contacts. This is our contact information. You can go to SHIP, 1-800 Medicare, and these are partner agencies we work with, like the Caddo, Cajun, in different areas of the state. You can call them and get assistance as well. All depends on where you live. I'm sorry. So that's it for me. Do you have any questions? I know
That
I'm a
was
fast talker.
that was fantastic, Miss Barbara. I really appreciate how you broke things down, because you hear all of the letters sometimes, and it is confusing how what's one but not the other. So thank you for such a comprehensive list and all of the differences. I have a few questions, and then I see that some questions are also in the chat. So, anybody that's on the call, if y'all have any questions, please feel free to put those in the chat. So, a couple of questions that I have that were submitted, Miss Barbara. What do people usually do for eye or dental coverage once they qualify for Medicare?
Well, generally, those people would generally pick up a Medicare Advantage plan because this is the only plan there is that covers dental, vision, and hearing. That's just the Medicare Advantage plans.
Okay. What are some of the advantages or disadvantages to Advantage plans?
Well, the fact that you're going to need a referral when you go to the specialist is a disadvantage. It didn't used to be there, but they started that this year. Now you have to have a referral, and it's just for a service area. So when the Medicare Advantage plan, if you live in Baton Rouge, that plan may not work for you if if you were in Shreveport. It's just for a
Mhm.
service area, and you cannot now. If you were to travel and you go see your daughter in California or something like that, no matter what plan you have, they have to stabilize you in an emergency. But that's about it. But that's a disadvantage as well. But the fact that you could afford is more affordable for a person that got that low level income, but not low enough for Medicaid, just above. And it doesn't cost them anything to see a primary doctor. That's always zero.
Mhm.
And and that's about it. It's just a service area. Didn't you have to go in the network? You got to go to the doctors and the hospitals in the network. That's why it's so important that you check with your doctor, call the doctor's office, talk to the billing people, find out what plan your doctors work with. It's not always easy to talk to an agent about that because sometimes they may have a list that is not up to date. It might not be an updated list of providers. So I always tell people to call the doctor's office itself, find out what health plans the doctor work with.
Mhm. Can you give us some examples of companies that do Advantage plans? I know that you had mentioned the Humana Gold Plus. What
Human
are
Gold.
some other like commonly heard about
Oh,
plans?
People's Health. They have People's Health, Humana Gold Plus. They have WellCare. You have Aetna. We have a new plan this year called Devoted. We have Blue Advantage. And I don't think we have but 6 or 7 in the state, but each one of those plans have quite a few plans under their umbrella. So
Got
Humana
it.
may have 7 plans. Blue Cross might have 2 or 3. Then you got one called AmeriHealth. AmeriHealth have a plan this year that's new to us as well.
Hmm. So I know you had mentioned that open enrollment is in October. Are you able, I mean, now we're just about halfway through May. Are you able to look at what the differences will be that will be starting after open enrollment? Or like how soon are the new change information available?
Well, starting September, you should get they should get letters from their companies that they have a Medicare Advantage plan. September, that's what they're going to do all the mail outs. So if they have any changes to the plan, they'll come out in September. I think they get the Medicare and U book in September because everything has to be to CMS by a certain time.
Hmm.
And so if any changes to the plan that come out in September, we are not going to have anything in our system until October.
Okay,
So October 15th, we're gonna have everything available for you for the next year. You
got
can
it.
call us. We'll be glad to do. a comparison for you. It's free of charge. It's our pleasure, really. We like to do them. I'd rather for them to call me and let me get that list of medicines. I don't care how many medicines you have. We're going to find your plan and we're going to let you know what the cost of that plan is and how much your medicine will cost you all year long, how much you're going to be paying out of pocket. And that's why we ask you the name of your pharmacy, because we're going to put in the pharmacy that you use and tell you how much that medicine is going to cost at that pharmacy for the entire year.
That is so helpful, and I feel like it's such an underutilized, and lesser known about program that is available through our state, and you know, invaluable resource right there. A couple of other questions talking about like open enrollment time. Like, is it possible to change from a Medicare Advantage plan to original Medicare? Also, to a second question to that, I hear sometimes people refer to it as traditional Medicare.
Yes.
Is that the exact same thing, or
It's
those
the
two?
same thing. Traditional Medicare, original Medicare, it's the same.
Okay. So is it possible to change from one to the other and back and forth?
Yes, during the open enrollment from October 15th to December 7th, you can go from one Medicare Advantage plan to another Medicare Advantage plan, or you can drop the Medicare Advantage plan and go to original Medicare. But if you do that, you have to pick up a drug plan because you can't be without drug coverage.
So you would pick up the Part D plan,
That is
and that's
correct.
through a private company. And so
Yes.
I'm sure it's kind of like how you do your taxes now. Everything is on the computer. So whenever you are going and selecting what Medicaid, what health insurance, Medicare you want for the following year, does it then give you options for the Medicare Part D plan
Well,
possibility?
actually, I'm sorry. When we go on, we use Medicare.gov.
Okay,
So when we go on Medicare.gov, we're going to put in your medicines. First of all, they're going to ask you your zip code. Put your zip code in, and they're going to ask you whether or not what kind of plan you're looking for, a health plan or a drug plan. And then you tell them that. Then they're going to ask you, do you have any Medicaid? Do you get any help or system with your medication costs? After that, then they ask you whether or not you're ready to put medicines in. And when we put those medicines in, once we put the medicines in, give them all that information, we look at the top three plans that come up because the computer does all the work once we put that in. And if we could tell you about the top three plans that come up for you in your area. But if you
hmm,
have a specific plan that you want us to look at, we can look at that specific plan as well. And some people, well, I have people call me every year, and quite a few that have a Medigap policy, the one they have to supplement, and all they change is their drug plan. So they're looking for the best drug plan for the next year. So I
hmm,
get those calls every year.
yeah. What about if somebody moves in the middle of the year? Like if they move from 70806 to 70869 or whatever. If they move zip
Well,
code.
it all depends. If they're totally out of the service area, if you move out of the service area, you get a special enrollment.
Okay.
Yeah, that'll give you a special enrollment. If you move from one state to another state, just give you a special enrollment.
So then you would just re-enroll at the time that you have
Yeah,
the
you just change because if you're like just like if you're living in Texas and you come to Baton Rouge or Louisiana, then you have to choose. You have a health plan in Texas. It's not going to work in Louisiana. So you have to apply for a plan in Louisiana.
got it.
Just like with the Medicaid, every state has Medicaid, their own Medicaid program. So you have Medicaid in Texas. That Medicaid is not going to work in Louisiana. You have to apply for Medicaid in the state of Louisiana.
Hmm. How long does that application process normally take?
Oh, it's not long. Once we get all your information, we decide what plan you want. What, 10 minutes
And then
to
it just
sign
is
you up?
an automatic, boop, you have coverage?
Well, if we sign up in January, oh no, it's May. You sign up for a plan in May, it's gonna be effective on June 1st.
Okay,
That's your health plans and your drug plans.
got it. Okay. Another question, does Medicare or a Medicare supplement cover or assist with caregiver counseling?
Caregiver counseling, break it down.
So that may be referring to something like the guide program, which currently is, I wonder if, or maybe this is asking, you know how sometimes health insurance can help pay for a counselor or a mental health professional?
Oh, that's under the that's one of the that's all that's on the preventive services. A lot of those
Okay.
cessation, they have quite a few of those. But
Okay.
I can't name them all for you, but I know they do have a lot of those things that are free under
Yeah. So
preventive services.
if this particular person was interested in a certain type of preventative treatment or like service, they could reach out to you and say, which ones would this be covered under? And y'all would be able to look through those.
Yeah, but everybody get a Medicare and new book, and I'm telling you, probably have about 10, 12 pages of all those preventive services. And I'll tell people a lot of times, I would take my Medicare and new book to the doctor and tell that doctor to sign me up for everything that's free. Because it's free. Why not? Because you're
Absolutely.
trying to stay well. So I'm telling you, I've told quite a few people, take that book with you because you got a lot of free preventive services that nobody even thinks about.
Right. Absolutely.
And you
Cognitive
want to do
screening
your
being
annual
one of those
wellness visit
things.
every year too. Yeah, they got an annual wellness visit you do every year. So if you did
Hmm.
the annual wellness visit, which is like a physical, if you did that on May 20th last year, that means you got to do it on May 21st the next year because 365 days have to pass. Every 365 days. So it'll be a day later every year that you do
Hmm.
it.
Yes. And, all of those preventative treatments and appointments, those can only help you towards in the future, to either,
That's correct.
we say that all the time whenever it comes to cognitive screening, help establish a baseline and, it could only support you with whatever new knowledge that you get. Okay, one person just has a comment and it says, shout out to SHIP. You all provide excellent, unbiased help with choosing appropriate plans and pointing out options. So, just a little testimonial for you, Miss Barbara.
Thank you.
Okay, another question. Can you discuss the main difference in the Medicare supplement and the Medicare Advantage plans? Are those the same thing?
No, those are two different things.
Okay.
The Medicare Advantage plan is just for a service area, and you cannot take it out of your service area. The Medicare supplement, you can use it anywhere in the United States. If Medicare covers it, that supplement is going to cover it. The most comprehensive Medigap policy we have right now, sometimes they say Medigap, sometimes they say Medicare supplement, but it's the same thing. So if original Medicare covers it, the Medigap policy will also cover it.
Hmm.
But it don't cover drugs, but you can use it anywhere in the United States, so you can move anywhere and you still be covered with that 20%. That's how they choose to cover that 20%. And that's the best thing because you don't have to have a referral or anything. You just go where you have to go.
Yeah, absolutely. Okay, another question. Is it true that at age 65, you have to register for Medicare whether you are working or not?
Yes, you have to do something. So if you're working, it would be to your benefit to notify Social Security that you're still actively working. Number two, you check with your Human Resources Department and find out if they require you to pick up the Part B of Medicare when you turn 65. If they say no, then you contact the Social Security office and let them know that you want to delay your Part B until you retire. And that way you won't have that penalty. But if they say you have to take it, you have to take it. You have to pick it up.
So regular like HR folks at a company, would they know how to navigate all of the Medicare nuances, or would you always
I doubt
recommend
it.
okay, you would always recommend talk to
They,
Ship.
they're gonna they're gonna say call SHIP, or either they're gonna tell them call Medicare. If you were to call 1-800 Medicare, they'll tell you call SHIP.
Hmm. How big of a team do y'all have there? Because it sounds like y'all spend a lot of detailed time with each individual person
We do. We have maybe 7 or 8 people right now.
for the whole state.
Yeah, we are responsible for the entire state. We got over
Mm,
940,000 Medicare beneficiaries. So those partners you see listed there, we had a contract with them so they can
mhm.
over to help us navigate some of these people that's all over the state. We can't be everywhere. But
Yeah.
that's why we picked up some partners and trained them. They can answer the questions that you have as well, any Medicare questions. If somebody want to go sit down and talk to somebody, you got prospective people in different areas of the state.
Yes. And so our service area is Capital Area Agency on Aging. So you see their
So
number
that's like
featured
13
on.
parishes.
Yes. So that would be if you're currently located within our service area, Capital Area Agency on Aging is the number right there that you would look at. And we actually had them present, when was that? That wasn't too long ago. They helped presented something with us. So
Mm-hmm.
um, good deal. So it's great to have that was Miss Dusty Lyons that we
Oh,
had
mhm.
from there.
Okay.
Okay, another question. Is mental health counseling covered under Medicare, and does it have to be required by a physician's order? Does it require a physician's order to be covered?
Now, I'm not sure about that, but I know it is covered and they do, it's like the same setup as Medicare. Like if you have, they have so many lifetime reserve date, they have so many copays. Tell that person, give me that name and number, and I'm going to call them personally when I go back to the office and really research this. And so I can call them back. And I
Okay.
promise I will call back.
All right, Miss Rachel, if you wanted to reach out to me, I can connect you and Miss Barbara for just to help provide any of those questions and answers. Okay, a couple other questions that I have.
Mhm.
How often can you change plans? So, let's say you move in the middle of the year, like you said, or you turn 65 in the middle of the year, and then you move. How often can you change your plan?
Well, generally, you can change plans during your initial enrollment. That's 7 months. You got 3 months before you turn 65 or your age of disability, the month you turn 65 and 3 months after. You got a 7 month window. So during that 7 month window, you can sign up for the drug plan or your health plan. If you do not sign up within that 7 months, then you'll have to wait because you've missed your window to sign up. And then while you're waiting, you have to wait all the way to the next year. You may have picked up a penalty. Number one, you'll definitely have picked up a penalty for Part D because they charge you per month, 1% per month. Part
Hmm.
B, as in boy, you get a 10% penalty for every 12 months that you do not sign up.
Hmm.
And there are different enrollment periods. Like if they were to miss signing up for A or B during their initial enrollment, they got a general enrollment period, which is from January 1st to March 31st. Then you can pick up that B if you didn't pick it up, or that A if you didn't pick it up, and it will start the next month.
Got it. So some of the like highlighted key times to remember are right before you turn 65. So if you're 64 years old, start
Start
paying
looking,
attention.
start doing your homework. Yeah.
And then if you are interested in changing or if you're having changes to your current plan, September is whenever a lot of times, September into October is when a lot of times the companies are going to say what's new. And then open enrollment is October to December.
That is correct.
So
But
just
you
some,
will also get one more chance to pick up a Medicare Advantage plan. If you already have a Medicare Advantage plan at the end of the year, come January 1st through March 31st, they have what they call a Medicare Advantage open enrollment. So you already have to be in one of those HMOs or PPOs to take advantage of it. But you only get to make one change. That's it, just one change within those 3 months.
got
And
it.
then that could be your final after that.
Okay. A couple other questions. Hospice. We talk to a lot of folks with hospice, and hospice is covered 100% normally.
Mhm.
Does that change for what type of, if you have traditional Medicare versus an Advantage plan? Do you have to have?
No, no, that doesn't. And then the hospital also give you that respite time too. I think it's what, 7 days every research period. I guess that's every 2 months. You get the little respite time where somebody can, they will pay for somebody to take care of your loved one while you're out
Mhm.
taking a break or something like that.
Yeah, they have the inpatient hospices, yes.
Mm.
And also they take care of your medicine, so it kind of
Yes, anything to do
helps
with
in a
that
lot of
disease
different ways.
process, they take care of it. Look, $5 a prescription. I think it is just $5 per med.
Okay, excellent. Let's see any other questions that I have. I was taking all sorts of notes, Miss Barbara. You okay, one question that I have, and I know we're almost at time. Um, I know you had spit out a couple of like dollar amounts a little bit ago. How
Mhm.
is your premium calculated? How is your
The
deductibles
Part B premium
calculated?
calculated, let me tell you how the premium is calculated. Medicare, they set the deductible, Social Security, whomever. And it's never in the Medicare and U book because that's the last thing Social Security gives out. That's why you never see that in the Medicare and U book. But the Part B premium, it goes on how much money you make. All depends on what your income is. The
Okay.
average person is going to pay $202.90. A person that have the very low income, the state pays it for them.
Hmm.
All depends on how much money they look at your taxes. Like if you were to leave your employer plan and you turn 65, they're gonna look back 2 years at how much money you were making, and they're gonna base it on what you made 2 years ago. And if you're making, let's say, $110,000, then you won't pay that 202. You'll be paying like 284. It all depends. The more money you make, the more you pay in Part B premium.
Okay. Okay, that's
But
good
they
to
look
know.
back at your taxes. That's how they come up with that.
Okay, so some of those different those amounts could look different
Yes, all
depending
depends on how much
on
your
what your
income is.
income is. Okay. Um, Making sure all of my little questions were answered. If anybody has any other questions real fast, if you wanted to put them in. Okay, one more question. Um, it's the same person that was asking about the if they needed an order to see like a mental health counselor.
The mental health, okay.
They're asking,
But that's a
she's trying to
special.
see
They're gonna,
if,
if it's a that mental health is gonna be a specialist and they got a HMO or a PPO, they gonna if they got a HMO, they definitely gonna need a referral. But they got a PPO, they may not. But
okay.
I'll still research it for them and give a call back.
Yeah, and great to think of if it was within that preventative services line item, or possibly could be something that if you go to your like coverage within your particular plan, they may have particular social workers or licensed counselors who are covered under your
Right.
plan and kind of see it that way. But
Yeah,
a
that
great
depends on
reason
which
to reach
plan.
out to SHIP. Fantastic. And I see that y'all have y'all's phone number right up there, and I will also put that in our follow-up email.
Okay.
Miss Barbara, just in closing, is there something that you wish, speaking from the lens of your work in Medicare, is there something that you just wish that every person knew?
Yeah, to call to call ship. I wish that everybody would actually do a comparison every year. It's so many people that don't they get in plans and they stay in those plans 10, 12 years and the plan keep going up and up. And so you got people that pay $120 for a drug plan when a zero premium plan would do them just fine. But if
Mhm.
they did a comparison, then that's how you find out stuff. But a lot of time they just want to stay where they are, but it will be beneficial to them. And everything is going up right now, so it'd be more beneficial to save money wherever you can save money. And then there are people
Absolutely.
that actually may qualify for extra help or the MSP program and they don't even know. I had a lady yesterday, and her income is only $1,200 a month. She have no extra help, no Medicaid, but she qualified for both. They just don't know sometimes.
Yeah. You don't know what you don't know, and
Yeah,
that's what
and then
makes
when you're new to Medicare, you don't even know what questions to ask. So if
right.
I get that phone call, I tell them about everything. because you don't
Yeah.
know if a family member is paying this for them. It doesn't matter if their income is low. I still tell them in case there is a family member that's paying for it, or son or daughter or something like that. But I would definitely like them to do a comparison.
Yeah, and see what their options are. We can
Yes,
only
you
make
got
our best
options. You
decisions
got,
if we
yeah,
know what all the
it's
options are.
always, because just because your medicine's covered this year, that don't mean it's covered next year. Because all the plan, they do this, they make changes to their plans every year. And
Mhm.
if you stay with what you have and you don't even know that they've made these changes, they could change the tier structure on your drugs. Drugs you got for zero last year, now that drug might be $10 and you don't even know, and you haven't budgeted that. Then when you go to the pharmacy, then you're shocked, you know. And
Yeah.
if you don't get extra help, whatever plan you have, you are locked into that plan for a whole
Hmm.
year. So tell
Absolutely.
them just call Ship. We'd be glad
Yes,
to help
ma'am.
out. We don't care how many calls we get. Please call us. We will get to it. And we
Thank you, Miss
would love to
Barbara.
do that for you.
Thank you. I so appreciate your time and your expertise in all of these things and making it digestible and understandable and making something that seems very complex in lay people terms. I so appreciate your support. We're getting a lot of comments saying awesome presentation and thank you so much, Miss Barbara. Excellent job. And
Well, thank you
also,
for having
everybody,
me.
I wanted to let y'all know this was Miss Barbara's first Zoom presentation and she
Yes.
did 10 out of 10. Spot on.
Thank you so much. Thanks so much for having me.
Absolutely. Thank you, everybody, for joining us today. We'll see y'all soon.
Okay, bye-bye.